With that, I would like to welcome everyone to today's RPS GlomCon session on genetics in kidney disease, specifically talking about the Alport spectrum disorders. And I'd like to also acknowledge the GlomCon sponsors, Travari, Novartis, and Vertex. And as we go through today's session, if there are any questions, please feel free to write them in the chat and we'll go through them in the end. And it's my great pleasure to introduce Professor Danica Ljubanovic, who is a professor of pathology at the University of Zagreb School of Medicine and head of the Department of Nephropathology and Electron Microscopy at the University Hospital Dubrava in Zagreb, Croatia.
Thank you very much, Mei Lin, for your kind invitation and for saying a few words about me. And thank you that I can present our work in almost last 10 years. And so the topic is Alport spectrum disorders. The Alport spectrum disorders are diseases due to mutation of the collagen type 4 genes. Collagen type 4 is the major component of the all basement membranes, including glomerular basement membrane. Collagen type 4 is made of alpha chain. There are 6 types of collagen 4 alpha chains, named from alpha 1 to alpha 6. These chains form protomers or triplets. Even there are a lot of possibility, a lot of different combination with these 6 types of chains. In human bodies, actually, there are only 3 types of protomers. One made from alpha 1 and alpha 2 chain, one from alpha 5 and alpha 6, and for us today the most important, protomers made of alpha 3, alpha 4, and alpha 5 chains, and these protomers are actually present in glomerular basement membrane. These protomers form a network in which other GBM proteins, including laminin, heparan sulfate proteoglycans, nitrogens, are bound. And collagen type 4 with these proteins form glomerular basement membrane, which is together with endothelium and podocytes form glomerular filtration barrier. So if we have a mutation in genes for alpha 3 or alpha 4 or alpha 5 chains, we have Alport spectrum disorders or disorders of collagen type 4 mutation. Because gene for alpha 5 chain is on X chromosome, if patient have variants in this gene, he or she will have X-linked disease. And the genes for alpha 3 and alpha 4 chains are on 2nd chromosome, and if there is variant in these genes, patient will have autosomal disease. 65% of patients with Alport spectrum will have X-linked disease, and the rest will have autosomal disease. 15% autosomal recessive and 20% autosomal dominant. Severity and type of disease depends which gene and how many of them are affected. The patient have variant in alpha 5 chain genes, it's linked disease, severity depends is male or female. And if there is variant in alpha 3 or alpha 4, it depends is it recessive or dominant, or is it patient homozygous or heterozygous. Some patients also can have degenic mutation. Additionally, it's important a type of mutation and other risk factor for progression of disease. I will talk about that later, but we can mention that the risk for progression with the same mutation are actually focal segmental glomerulosclerosis, proteinuria.